Hello everybody, this is Dr. Kevin Connors sharing with you some of my favorite things to use for different disorders from a natural perspective. And today we're going to talk about turmeric, or the active ingredient in it is curcumin. If you have other questions, make sure you visit our clinic. The website's on that slide, connorsclinic.com. And make sure you download my book. I talk a lot about this and a whole bunch of other things in my book, and it's a free download. So if you go on a clinic website or you click the little icon on the right side of the video, the top right side of the video, you can download my book for free. The icon will take you to our website and you'll see where the download is. And what we did with the book is we turned it into a course. So not only will you won't just have this gigantic PDF of 350 pages that you got to read through, but you get some videos similar to this to kind of precede the chapter, and then you get the chapter. So it kind of breaks it into a course. It makes it a little easier to digest and easier to understand. You get it over the course of about a month. So hopefully, there's a lot of information. And you got cancer, your loved one has cancer, you're searching for things to do. It becomes extremely confusing. We're just trying to take that out of the equation. So turmeric, or curcumin, whatever you want to use to describe it, is a spice from India. Ground up, it's very orange. That's probably the worst thing about turmeric is its color, because it can stain your clothes. So if you're going to use it as a topical in a topical cream, which we do with a lot of patients, we create our own topical salves, and we use curcumin a lot with that. It's very staining, so you have to put something over in a big bandage, cover it up somehow, or it'll stain all your clothes and you'll never get them unstained. I mean, it's done. So using it even in cooking and stuff, you have to be careful that you don't spill it on your clothes or spill it somewhere where you'll track it around the house and you will not be happy. But it is a fantastic tool to help with all sorts of cancers. It literally blocks basically every cancer it helps with. So you cannot really go wrong with turmeric. You just cannot. It's almost impossible to overdose on it, and it decreases the inflammatory process without decreasing the immune system. And that's a huge piece of turmeric, where the medical approach to decreasing an inflammatory process is basically using something like prednisone, which will basically shut down the Th1 side of the immune system. Well, you need that Th1 side of the immune system to prevent cancer. That's why long-term use of prednisone greatly increases your risk for cancer, because if you don't have an immune response, you're never going to be able to help with the apoptotic process and kill cancer cells. So cancer can start because of an immune suppression. Well, turmeric decreases the inflammation, also helps increase apoptotic cycles, which is the normal programmed cell death. So it increases cell death and decreases inflammation without decreasing an immune response. So it just works fantastic. Matter of fact, studies have been shown that it works on so many stages of cancer's progression, so many pieces of it. Overexpression, that centerpiece, it says overexpression of oncogenes, which are genes that push cancer along. HER2 positive genes, which are estrogen receptive cancers, so breast cancers, uterine cancers, a lot of the hormonally driven cancers, turmeric is just so beautiful for. So you cannot go wrong again with adding turmeric. Turmeric also decreases the adhesion factors. So metastatic tumors are started by circulating tumor cells that break off the primary tumor site and do exactly what their name is. They circulate through your body looking for a place to set up home and start a family, per se. Now, there's some adhesion molecules that have to take place for that circulating tumor cell to stop and adhere and start to grow and start to go into rapid replication phase and thereby be cancer at that site, and then it would be a metastatic cancer. Well, turmeric does fantastic things to break those adhesion factors, so not allowing circulating tumor cells to do what they want to do. That is, start cancer somewhere else in the body. So using turmeric is super, super important. And always on this, understand too, if you're doing chemotherapy or radiation, there's no reason why you cannot do turmeric or curcumin. So even if your oncologist says you cannot be doing any herbs or anything else, do your own studies because he doesn't know what he's talking about. So turmeric and curcumin are something that you should be adding to your protocol. We'll talk about dosage in just a second. Turmeric helps block this tumor progression in every stage of its progression, in initiation, tumor promotion, tumor cell survival and proliferation, which is rapid replication. Curcumin helps break that. Angiogenesis, it decreases angiogenesis by tumor cells. Angiogenesis is when a tumor increases a laydown of new blood vessels. So angiogenesis is the creation of new blood vessels into a tumor so that that tumor can be fed and the tumor can grow more rapidly. You don't want angiogenesis into a tumor. Well, curcumin helps decrease that. And like I said, it breaks adhesion molecules, so it decreases your chance of metastasis. So this slide talks about where other things that will decrease an inflammatory response can decrease an immune response. Turmeric decreases an inflammatory response at different levels, so it doesn't decrease the immune response that you need so desperately with cancer cells, kind of what I just talked about before. Turmeric curcumin is also very multi-targeted. It works on so many different levels, so many different areas. This slide alone we could spend a couple hours on because it just works on everything you want it to work on. In my book I talk about a 10-step protocol that you want to bring to your doctor if you have cancer and make sure that you solve these 10 steps. Well, curcumin really solves many of those 10 steps. So it's a huge player and something that is good to add to cancer. It's not just for cancer either. So turmeric is very good for brain inflammation. We use it on any Alzheimer's, dementia patients. You also use it on traumatic brain injury. It's a huge player in decreasing brain inflammation, helping heal the blood-brain barrier, helping heal the vascular area, helping heal inflammation in the endothelial layer. So that has to do with heart disease, strokes, any heart blockages or vascular blockages. Turmeric is a great player in that. Helps decrease blood sugar. It's an immune booster, helps with weight loss, wound healing, and so many things. It's a great player. So how do you get turmeric? Well, you can take it with a capsule like this. Now this is a Designs for Health product. There's some other really good products out there too, so I'm not just pushing this company. But turmeric needs to be, here's 2 rules for taking turmeric. You need to take it with a fat. It's also good to add a little black pepper with it. Not as important to add black pepper with turmeric as it is to add black pepper with resveratrol, but it still helps preserve the half-life of the product once it's in your bloodstream. But absolutely, when you take turmeric, you need to take it with a fat. That is the most important thing. Matter of fact, there was several studies, a decade or so ago, that talked about turmeric as being so effective, and then they did a study using turmeric powder on a different group of people, and they didn't get the same results until they found out that the first group of people that they did the studies with were eating a fatty diet and were taking the turmeric when they were eating the food, and the second group of people were taking the turmeric on an empty stomach, and neither one of these products actually were emulsified in a fat. You need to have the turmeric emulsified in a fat, or if you're going to just take powdered turmeric, you need to take it with a fat. So there's multiple ways to get turmeric in your body then. Number 1, you sprinkle it on your food. So if you sprinkle it on your food, there's fat in your food. It has to be a fatty food, so you can't sprinkle it on broccoli and think you're going to get a good dose of absorption there, unless the broccoli has been sauteed in coconut oil. So you need to sprinkle it on a fatty food and take it that way. That's a good way to do it, but some people don't like the taste. So well, I don't want to take it with food. I don't like the taste of turmeric. It's spicy. It's got that Indian flavor. It's not really hot spicy, but it's got that Indian flavor, and some people don't like it. I love it, but some people don't. So, second way to take it, you can go buy bulk turmeric in your health food store, get organic bulk turmeric, and you can just take it orally. Again, you're tasting it, but you have to take it with a fat, so you chase it with coconut oil. So you take a teaspoon of powdered turmeric, chase it down with some water, take a tablespoon or teaspoon of coconut oil and chase it with that too. You need a fat in your gut when you take it. Take it right around a fatty food. So gulp down a teaspoon of turmeric right after you ate a fatty food, like a regular meal with some fat in it. That's the second way to get it in. Or you take it in a product that is already pre-emulsified. This curcumin, this C3 curcumin of Designs for Health, is already pre-emulsified in an organic, cold-pressed sunflower oil. So you don't have to worry about that. And with my patients, when I want them to take turmeric, I want to have them take maybe a capsule of this every 2 hours, or even a capsule of this every hour of their waking day. It's really hard to be taking that much coconut oil and you don't have food in your stomach throughout the whole day. So sometimes it's best to get it in a capsule form like this that's already pre-emulsified in a fat. Does that make sense to you? So if you have to rewind this a little bit and listen to that again, you have to do that. Now a dosage typically like this with a capsule is anywhere between 300 and 500 milligrams. This particular product, I believe, is 400 milligrams. Now, you want to take, depending on what type of cancer you have, you want to take upwards of 3 to even 8 grams. There's 1,000 milligrams in a gram. So this is where I have a person maybe take one of these an hour during their waking day, especially if they have a colon cancer or something like that. It's very, very good for that. Multiple myeloma responds really well to curcumin as well. Really, go back to those early slides, almost every cancer does. So it's just super beneficial for you. So those are some different ways to get it. Oh, this slide just talks about that bulk turmeric with cooking, but make sure it's in a fatty food. So you can even sprinkle it on your broccoli as long as you sauteed it in coconut oil. Hopefully that will be helpful for you. There's just tons of studies on turmeric out there. I tell you, it's very populous studies if you want to Google scholarship search some of the curcumin studies out there. It's really, really all positive, just fantastic. So I hope this was beneficial. If you have any other questions, just check out our website, connorsclinic.com, or feel free to call us and set up a consultation appointment if you need so. All right, bye-bye.